Hi, hello, myself N Hari Krishna from Mingchi University of Technology. I'm a PhD student from Biomedical Engineering and Medical Devices. And thank you, Professor Wang. Today I'm going to discuss a medical device called dialyzer, is an artificial kidney, and the need statement of dialysis to assist the peoples with end-stage renal disease by enabling the effective hemodialysis through healthcare stakeholders savings approximately 1 to 2 million lives globally each year and improving the patient survival and quality of life. And the introduction to the core of hemodialysis, a remarkable medical device that saves the millions of the lives. The dialyzer, it's also known as artificial kidney. It is a single most important component in the dialyzer. And the dialyzer, why is dialyzer needed? The healthy kidney filters blood like 180 liters per day. The human kidney will filters like 180 liters per day, and they remove the waste products like urea and excessive fluid. And when the kidney fails, like due to end stage renal disease or ESRD, these function stops. Like filtering the waste from the kidney might get stopped. So the waste and the fluid is build up. They become toxic to the body, and it will make troubles to the kidney. And the solution is, if the amount of the waste is stored in the kidney, so how to treat that one if the kidney got failed? So we have the process called hemodialysis. The key point is hemodialysis is the treatment that cleans the patient's blood outside the body. Like we're gonna take out the blood from the body, and the blood is from the patient through the dialyzer and then return. This process is typically done 3 to 4 times per week for 3 to 5 hours. And what is dialyzer? Dialyzer, it's a filter of the dialysis machine. It is a disposable cartridge. You can see the like fiber kind of things, like threads kind of things inside. And it is a disposable cartridge used once per a patient per treatment. Its job is to mimic the function of a human kidney. Like it should mirrorize the human kidney. That is the main function of it. The anatomy of the dialysis, like dialyzer, you can see the hollow tubes as I show in the last figure. You can see here, same like there is a thousands of hollow fibers, like 10,000 to 20,000 microscopic fibers, and the walls are the semi permeable membranes, and the large scale are like 1 to 2 meter square, the semi permeable membranes. And the anatomy of the dialyzer is part 2, the compartments. The blood compartment, the blood flows inside. You can see here the blood flows inside, and the tiny hollow fibers. The dialysate compartment, a cleaning blood called dialysate flows outside the fibers. You can see here the blue color arrows is also known as a dialysate. These two fluids never touch. They are separated by the membranes. They both are separated by the membranes. Like inside is the blood flow and outside is the dialysate flow. They both never touch each other. And the guiding principle, what the main guiding thing here is the counter current flow. The blood flows in one direction, the dialysate flows in opposite direction. This is called counter current flow. Why? That minimizes the concentration gradient, making the filter much more efficient. This is the most important filtration process in the hemodialysis. And first is the functionalities, like first one is diffusion, like cleaning the waste. The concept is solute more from the urea of the higher concentration to the low concentration. In the practice, the patient blood is high of waste like urea, and the dialysate flows is low in the waste like zero urea. Results, the waste products like urea, keratin naturally process out from the blood through the membrane pores and into the dialysate fluid, which then discarded. Like you can see here, the these both are separated by the semi-permeable membrane. So the waste particles from the blood will transport, like they have higher mass, like the particles are more in the blood, so they will be transferred into the semi-permeable membrane, and then the waste thing will be collected into the dialysate will be thrown away. So so the waste product are transferred from blood to the dialysate through the semi-permeable membrane, so that the blood and the dialysate will not mix. So the semi-permeable membrane acts as a filter here. And second is the ultrafiltration, removing the excess fluid. So the concept, the fluid is removed using a pressure gradient like hydrostatic pressure. In practice, the dialysis machine creates the positive pressure in the blood compartment. You can see here the positive pressure will be pressure is applied in the blood compartment area. It creates the negative suction pressure in the dialysate compartment. The result, this pressure difference called the transmembrane pressure or TMP, physically squeezes the excessive water out of the blood and into the dialysate. Like you can see here in the diagram, like the excessive waste or the fluids, if something is there in the blood, it will be pressured by hydrostatic pressure, and it will come the excessive fluid into the low pressure dialysate, like it will come into the downside, and then the water will be removed. And the key features are the materials and biocompatibility. The materials are the modern membranes are synthetic, like polysulfone, PES, and biocompatibility. It is critical. The most material must not cause an immune or clotting reaction in the patient. So it's the most important thing. And one is the type of fluxes, like zero low flux, like smaller pores, like slower or older technique. And the higher flux is the larger pores. You can see the larger pores, it removes the larger waste molecules more efficient. So in previous we have lower pores, like low flux, and now it was changed to the higher flux called larger pores. And the design and the principal engineering of optimal blood purification, like biocompatibility. The materials must not trigger adverse reactions with the blood component, ensuring the patient's safety, ensuring the prolonged exposure, and efficient filtration designed for optimal solute clearance, and balancing the removal of waste within the preservation of excessive components, and designing for the optimal solute clearance, and balancing the removal of the waste with the preservation of extensive components. The fluid management, like a precise control over the ultrafiltration is crucial for removing the excess fluid without causing the hypotension. And durability or sterility, reboot design for single-use applications, and guaranteed sterility to improve the to prevent the infection. Every accept of dialyzer design is meticulously crafted, effective, and safe blood purification. And pre clinical evaluation and testing for the efficiency and biocompatibility. In vitro testing, like stimulating the blood flow and solute clearance in laboratory testing settings, and excessive dialyzer performance and membrane integrity. And in vivo animal studies, like evaluating the device safety and efficiency in the animal models to understand the physiology responses and the potential complications from human trials. And the biocompatibility and assessment, the rigorous testing of for the potential immune response, coagulation and activation, and materials degradation up to contact with the blood, throughout the clinical evaluation is critical for ensuring the dialyzer safety and effectiveness of the human use. And the safety and the risk, like mitigating the complications in the dialysis therapy, like blood loss and hemolysis and infection and thrombosis and hypersensitivity, like risk of blood loss due to circuit disconnections or hemolysis for excessive shear stress on the red blood cells, and the risk of bloodstream infections from the vascular access sites or contaminated equipments, and clot formation within the dialyzer are excessive, requiring the anticoagulation management, and the adverse reactions to dialyzer materials are, are sterilant, and the vigilant monitoring and advanced device design are the crucial for minimizing patients' safety during the vital treatments. And the clinical translations, like bringing the device from bench to bedside, like a phase 1 and 2 trials, like initiating the human bodies to confirm safely dose finding, like dialysis prescriptions and preliminary and EC in the small patient cohort, and phase 3, the large scale trials comparing the new dialyzer agents, establishing the treatment, assessing the long term outcomes and adverse events, and the post market surveillance, monitoring the ongoing market, the patient safety and through the process, and available for collecting the red blood cells. And summary, a life sustaining filter, a key point is that the dialyzer is the artificial kidney, and it uses the diffusion to remove the waste products. It uses the ultrafiltration to remove the excess fluid. It relies on the semi permeable membranes and counter current to work efficiently. It is a life sustaining and a high tech device that makes hemodialysis possible. And this is a realistic image of the patients undergoing the dialysis with the dialyzer clearly visible here. You can see here, this is the dialyzer, and the blood is collected from here, and and the process will be done inside here. You can see here the dialysate is also known as the blue color liquid, the dialysate, and you can see here and here the red color one and the blue color one. So the filter, this kind of filter, what they will do, they will use the halo tubes, and they will filter the whole human body and human blood, and they will return the safe blood to the human body. And thank you, and if you like the video, please subscribe to my video, and if you like the content, please follow my page. And thank you very much, and thank you.